please. So I'm going to play a clip now. It's about 5 minutes long, and it's the Right Honourable Jess Phillips MP. Every year, Jess Phillips reads out the names of women who are killed by men in England and Wales in the year preceding. In the last reading, which was in February of this year, there were 95 women. She does reference a couple of names who are local women. And also a lady who took her own life as a result of domestic abuse. I'll tell you a little bit more about them after I've played it. It is really, really emotive. So again, do please make sure that you exercise self-care. So I'll just play it now.
The women whose names I'm about, they left us breadcrumbs, left us clues as to why they died, and we cannot stand and say any more that lessons will be learned. What I promise is that I actually learn the lessons. Here is the list this year. Zay Wang, Pauline Sweeney, Carol Matthews, Ursula Allman, Tiffany Render, Frances Dwyer, Ruth Baker, Kennedy Westcar Sabarosh, Samantha Mickelber, Rachel McDade, Lisa Welford, Karen Olivia Potter, Tanjit Riaz, Anita McKay, Barjan Kaur, Catherine Parton, Emma Finch, Margaret Parker, Amy Gray, Maria Nugara, Patsy Chinyang, Delia Hacksworth, Joanna Ward, Lauren Evans, Maxine Clark, Scarlett Vickers, Sophie Evans, Joanne Samak, Carol Hunt, Louise Hunt, Hannah Hunt, Jenny Sharp, Alana Odysseus, Laura Robson, Kulsuma Akhtar, Rebecca Simkin, Olivia Wood, Courtney Mitchell, Nina Denisova, Alberta Obingham, Stephanie Marie, Sophie Watson, Vicky Thomas, Eve McIntyre, Montserrat Martorell, Cher Maximum, Brodie McGregor, Zanil Sabanda, Bryony Gawaith, Bertle and Aubrey Bertle, Davinia Graham, Barbara Nomakosa, Christine Everett Hickson, Juliana Prosper and her children Giselle and Carl Prosper, Rachel Simpson, Mary Ward, Luca Bennett Smith, Anita Rose, Mashal Ilyas, Rhiannon Sly White, Catherine Flynn, Sadie Butler, Rita Felming, Cheryl McKenna, Carol James, Phoenix Spencer Horn, Harshita Brella, Alana Armstrong, Margaret Cunningham, Christine Spirane, Margaret Hanson, Karen Cummings, Astra Sirapina, Miriam Barosh, Gemma Devonish, Joanne Pearson, Tihona Grant, Heather Newton, June Henty, Layla Young, Julie Buckley, Jamaluta Tuswana, Diane Cleary, Claire Schick, Margaret Werby, Carmen Coulson, Rita Lambourne, Megan Hughes, Lisa Smith, Anne-Maria Muraru, Leanne Williams, 2 women from Birmingham whose names have not yet been confirmed. Finally, though the suspects have not been identified, I would like to honour the lives of Dora Leese and Christine Jeffries. Also, in the last year, Sharon Holland, Chloe Holland's mother, has asked, because her name would never have been read out on this list, if she would be remembered. So I ask that we remember Chloe, and we remember alongside her the list of women who died from suicide or unclear, sinister and hidden circumstances where we know there was a history of domestic abuse or sexual violence. Those women's names will not make it onto this list because nobody has ever been held accountable for their deaths. I promise today that we are working on these hidden homicides. They deserve better. They deserve justice. Yeah. About to read out.
Just want to check that everybody's all right. I've watched that a couple of dozen times in the past couple of months when I've done this training, and it has the same effect every single time. Every one of those 95 women was a woman who had a life in front of them. Ali, could you go back to the slides, please? You are going to see some pictures of a couple of the names that were read out there. I'm not going to give much detail other than what is in the public domain, mainly to preserve the dignity of the ladies that we're going to speak about. If you could go to the first slide, please, Ali. So this is Tiffany. Tiffany was murdered by a man, in really awful circumstances. And Tiffany was a Whitehaven lass, so she was from Cumbria. She had a family and friends who cared about her very much. The next slide, please. And this is Ruth Baker. Again, had a family and friends. Ruth was murdered outside of the county, but Ruth was also an employee of Cumberland Council, so she was a colleague as well. It goes to show that domestic abuse can happen to absolutely anybody. Statistically, you are more likely to be a victim if you are a woman. However, anybody can be affected. And it doesn't just affect people who have been involved with services, it can affect professionals. I'm going to come on right at the end to talk about somebody else as well. So it will be happening to people who are our colleagues, as well as our neighbours and people that we know. Next slide, please, Ali. And this is Chloe Holland, who Jess Phillips read out the name of. Chloe's mum is a lady called Sharon Holland. She lives down south, and Sharon is one of the most wonderful people I've ever had the opportunity to meet. She wants good to come out of Chloe's death. She campaigned to the government for manslaughter by coercive control to be used more often. It is there already in legislation, but it doesn't very often end up with a prosecution. And Chloe took her own life as a result of coercive control. I met Jess Phillips with Sharon a few weeks ago, and Sharon had obviously asked if Chloe's name be mentioned, and Jess said that she would love to be able to read out a list with no names, and she'd also like to be able to honour everybody who dies from unknown circumstances or where they take their own life. But that list is absolutely massive, and we'll come on to that when we talk about some of our statistics. Chloe's mum, Sharon, is doing a session for us during our 16 days of activism, which starts next week. Next slide, Ali. So that's over to you. Thank you.
No problem. So just a little bit for what is a DARDR. And for some people who are in the virtual room, there used to be DHRs, but there has been a change to move forward to a DARDR, which is a domestic abuse related death review. And that has been changed to take into account that we now look at suicides and unexplained deaths as well, and much more reflective of the 2021 Domestic Abuse Act. So a DARDR will be carried out when a person aged 16 or over dies as a result of violence, abuse or neglect by a relative or someone they've been in an intimate relationship with. This also covers deaths by suicide where domestic abuse has been a feature. DARDRs are an opportunity for local agencies, community, society, pay attention to each victim. They're very much victim-centred and treat every fatality as preventable. And we need to make sure that DARDRs are there for learning, and it's what action comes out about that prevents future domestic abuse and ultimately any fatalities that are linked to domestic abuse. So current position in Cumbria at the moment, West Cumberland have 21 active DARDRs and West London-Furness has 6. By active DARDRs, that means that they are in the process where it could be anywhere from initial notification to sitting with the Home Office awaiting QA. And I know Cumberland, out of your 21, there's a large proportion of those are currently sat with the Home Office awaiting QA, which unfortunately does take about 12 months. So since LGR and the separation of all the different CSPs and the local authorities in Cumbria, we mirror each other's processes to make sure that for those agencies that are a county-wide footprint, everything still remains the same. We've brought in a new process where it's helping us to identify that immediate learning much earlier. And what we're doing is we're putting together presentations and slide packs for people so we can share them far and wide. And that's one of the purposes of today's session. The immediate learning we've recently identified are up on screen now, just to run through. And I'm sure for those who regularly sit on SARS, some of these won't be a surprise because I think you see them in SARS as well. We've got that improvement in professional curiosity and routine inquiry, multi-agency involvement and information sharing, risk assessment and management of risk. We've got that handover and step down processes. DARVO, which is deny attack reverse victim offender, which we'll go on to, so that's counter allegations. We've got domestic abuse typologies, the impact of children being cared for, suicide prevention, the links between domestic abuse and substance misuse. We've got something about the victims code, and then we've got some learning and development. So one to look at is about improving professional curiosity. So we've just got some questions on here for people, some notes, which go through what we're expecting with professional curiosity. So it's asking, is there anything what you see when you meet the adult child or their family that makes you feel uneasy, prompts questions? Do you see any behaviours which indicate abuse or neglect, including coercion and control? Does what you see contradict or support what you are being told? And how do your family members and other people in the household interact with each other and with you? Are you seeing any of those things? Sometimes it's that gut feeling where you want to go and ask a few more questions. So we're saying to ask those questions. So engage with your families on visits, making sure that you know how to, so you can talk and play with the children and things like that. Important to observe and consider. Do not presume that you know what is happening in a family home. Ask those questions, seek clarity if you're not certain. Don't be afraid to ask questions for families that you're working with, and do it in an open way. And just say, obviously, in an open way that they know that you're asking that so that you can keep them safe. And be open to the unexpected, and make sure that you incorporate information that does not support your initial assumptions. So making sure everything's in your assessments as well. We've got that we need to listen. So are you being told everything, anything that needs further clarification? Are you asking those questions to seek that further clarification? Is the adult child or someone else in the family household trying to tell you something verbally or by their non-verbal cues? Are they trying to get a message to you or trying to tell you something different? Are you concerned about how the family members are interacting and what they're saying? So we're saying here that the first step is to be professionally curious making time, finding that space to have a private conversation. We know it's difficult. Everyone's time and resources are stretched, but making that time to ask those questions so that we can identify any abuse or neglect. Ensuring that there's clarity. So are there any professionals involved? What information do they have? Is it useful to arrange a multidisciplinary discussion? Are there other professionals being told the same or different things? So having that conversation if everyone is getting the same information. Have other people noticed the same concerns as you? And if so, what action are you taking? What do we think should be done? What do we need to do to support that adult and child? And sense check information sources at all times. So in these slides, which I think will be shared afterwards, we've got some links that for the adult safeguarding boards. Thank you very much, Simone, and everyone at the Csab for doing the guidance on this. We've got professional curiosity guidance, and we've got YouTube links. They're all there for everybody. Those links will be active in the slide pack for you to use to access those resources if you need any help and guidance with professional curiosity. Then we've got multi-agency involvement and information sharing. So to prevent re-traumatisation, it's really important that we work closely with our teams. We share that information, all those agencies involved. Also making sure that they're included in those multi-agency meetings. So is everybody who's working with that family, with that adult, are they round the table at those meetings? And it should be clearly explained what is everyone's role. And we've got some links to the Csab information sharing guidance, and there is one for the children. Just to note, the one for the children, they are in the process of disaggregating those, but they will be the new ones will be coming onto the two children's safeguarding partnerships. Do you want risk assessment, Mary Claire?
Yeah, I can do. Thanks, Ali. So any risk assessment is only valid at the snapshot in time that it's done. It's like a COVID test. You could be positive in the morning and negative at night. And any risk changes, very frequently, especially in domestic abuse situations. If you think of it as if you're crossing the road, if there's a lorry that's 200 yards away, you can probably safely cross the road. If it's 2 yards away, you probably can't cross the road. What we're seeing in some of our DARDRs is that risk assessment hasn't been done often enough with changes. So it's any de-escalation or escalation of risk. If there's any change in circumstances, or every 3 months, if it's good practice. There was a bit of a misnomer that the only people who could do domestic abuse risk assessments were police officers and agencies like victim support. What we need to make sure that is if we get somebody making a disclosure, or we're professionally curious enough and we'll pick up that somebody's a victim of domestic abuse, we sometimes have a very, very small window of opportunity to be able to offer them that support. And if we miss that opportunity, we might never ever get that again. So it's a responsibility of everybody to risk assess. If there was a banana skin on the floor, you would either guide people around it, you would shout, mind that banana skin, you'd pick it up yourself, or ideally you call the person back that had dropped it and hold that perpetrator to account. Risk assessments for all professionals are called the DASH, which stands for the Domestic Abuse, Stalking and Harassment Risk Assessment. The police use something called a DARDR, so they have a slightly different risk assessment. It's a standard nationally adopted tool, and what we've done locally in Cumbria is we have added some guidance to it and some additional kind of actuarial questions. Professor Jane Monkton-Smith is a leader in the domestic abuse field, and she did an analysis of 500 DARDRs, and she saw commonalities in all of those DARDRs, and there was a timeline. As people went through the timeline, the probability of death increased. There's a homicide timeline, which is the likelihood of them being murdered, and there's a suicide timeline, which shows the likelihood of them taking their own life. So what we've done with merging the tools into the DASH is it gives you an actuarial risk assessment. So in Cumbria, we have one DASH, which is for children aged 13 to 16. Thankfully, we don't have enough deaths for that to have a timeline that goes alongside it. So that's a standard national tool. The combined DASH with a risk of homicide for people aged 16 to 59. Another one for people aged 59 plus. And one of the main reasons for having those two different ones is that people who are older adults have different abuse experiences to younger adults. Older adults are more likely to have experienced marital rape, for example. Marital rape only became an offence in 1992. So a lot of adults will say that sexual abuse is part of their domestic abuse experience. And then we also have combined dash with a risk of suicide, which is for all age. And that's for anybody who has got mental health issues, declining mental health, or if they have a life-changing event like having children becoming cared for, that does increase the likelihood that somebody will take their own life. Any risk assessment isn't just a yes and no questionnaire. There is space for professional judgment. So taking into account things like non-verbal cues, body language, what you believe as a professional as well, and making sure that all of that is documented. If somebody gets a phone call from the perpetrator in the middle of an assessment and walks out, don't just leave it blank. Do write on it that the perpetrator rang them and they had to leave, just so it doesn't look like you've only answered half of the questions. If somebody scores 14 yes answers, or you believe it's high risk, so they're at risk of either life-limiting or life-changing injury or being killed or taking their own life, that's automatically high risk. There are a couple of high-risk indicators such as non-fatal strangulation and sexual abuse. And if anybody comes out as a high-risk case, it must be referred to MARAC, which is the Multi-Agency Risk Assessment Conference. The MARAC is held in Cumbria 3 times a week. We have one for the north, one for Eden and Barrow, and we have one for the west. And on average, every MARAC per week has 10 people on it. So in Cumbria per week, there are 30 people who are at risk of death as a result of domestic abuse. And they're just the ones that we know about. You should always record MARAC discussion and actions on your case management systems. Something that came out of a recent review was that some people were taking the confidentiality statement at the beginning very literally. And it says something like, you can't discuss the contents of this meeting without the express permission of the chair. But if that one person's going and they hold that information, that isn't shared for other professionals who are, say, working with that family to be able to plan interventions. And we're also potentially putting our colleagues at risk if something's disclosed in MARAC that somebody, say, has weapons. And again, we should be refreshing that dash every 3 months as good practice, even with no change in risk. Next slide, please. Handover and step down. We see a lot of cases in our domestic abuse system where they tend to have loads of people involved and then things change and everybody kind of comes away from that. Anybody who's experienced domestic abuse should always be given contact details of other support agencies. They shouldn't be left at a cliff edge of support. There should always be a handover meeting. Again, everybody has their assessments to do. We all have our national standards. We all have our targets that we need to meet. But what we tend to do is we look at it from our perspective and our needs as professionals. If we can hand over to, say, one of the women's centres that's going to continue offering support, we should really be given an outline of what that background has been. Obviously, everybody needs to do their own assessment, but it just might prevent that handover being traumatic for that victim to have to make that disclosure again. Again, taking minutes of meetings, making records on case management systems is really important. And as Ali said, having everybody around that table to make sure that everybody's informed of how to best support that person. Next one, please, Ali. Do you want to pick this one up?
No problem. So I mentioned at the start Darvo, which some will have heard. There's quite a bit of work going on at the moment about Darvo. As I say, that deny, attack, reverse. So this is where perpetrators will deny that any abuse is happening. They will attack the victim or those who confront them, and they will reverse the role, so they will want to appear as the victim. This is really harmful. It confuses victims, it undermines support, avoids accountability. The last thing we want is domestic abuse perpetrators accessing support services and doing safety planning, which is aimed at victims. Some of the things to support for spotting Darvo is, so that deny, that never happened. The attack, you're ruining my life, and that discrediting of the victim. and that role reversal, saying that the victim is in fact the abuser. We need to ensure that we're validating victims, we focus on the facts, and we avoid emotional traps. Domestic abuse perpetrators are very skilled in manipulation, so it is something to look out for. There's a lot of work being done within the police and making sure we've got pathways in place for that. It is something we have seen in a number of DARDRs coming through. Typologies. So typologies of domestic abuse, this is something that all police officers in their DA Matters training taught about this. We do it in our Responding Well training. So it's research done. The two main theorists are Michael P. Johnson and Evan Stark. And Michael P. Johnson came up with, you've got these three typologies here of domestic abuse. You've got situational couple violence, so that is where it's situational based, there's no coercive or control or domination, it can be perpetrated by men and women. The violence can be severe and indeed can be fatal. It could be frequent or infrequent. They do not live in fear of each other, which is key. We've then got coercive control behaviour. We've got the intimate terrorism on that middle one there. And that's where we've got that coercive control. And perpetrators are inducing fear on their victims. It continues after separation. We see it really heightens up after separation, and it has in a number of our DARDRs. It's typically perpetrated by men. It's linked to homicides, escalates over time, so that escalation process, and it produces a negative impact on the victim's ability to act independently and in their own interest. So really is that coercive control on there. Then the third one is violent resistance. This is where we will see that a victim has fought back in self-defense. This could be physically, verbally. It might be an act of revenge or retaliation. They might fight in self-preservation. They do not seek to gain power or control over the perpetrator. It's typically perpetrated by women, and that's in response to coercive control behaviour. And for professionals who are working with couples, it's to have that understanding and have a look at all that background history to see, is this an incident where we have got violent resistance and it is a victim that is fighting back in that case. And it can be fatal. And there are some well-known cases, like a lady called Sally Challen, who went to prison for murdering her husband, and it went through court in quite a landmark case where it was eventually in her appeal accepted that the impact of the coercive control had meant that she couldn't have committed the murder. It was manslaughter. We've got on the impact of children being cared for. In a number of our DARDRs, we have seen children who have either been removed or at risk of removal. So it's that understanding of the emotional and psychological impact on parents. So you could see that there's grief, trauma, depression about following that removal. You see with some parents that there's substance misuse, suicidal ideation, long-term mental health issues. And we still see today the stigma and isolation which often follows that removal. And there's limited post-removal supports services available. We've seen there's a key study, and there's a link to it there with Birmingham University. Women who've had children removed are 14 times more likely to die prematurely, often due to intersecting issues like poverty, domestic abuse, and poor mental health. So there's some recommendations to please continue to provide ongoing support post-removal, use trauma-informed approaches, recognise that intersectional vulnerabilities like domestic abuse, poverty, mental health, and just that understanding. We've then got some information about suicide prevention. So domestic abuse is a significant risk factor for suicidality. Victims often experience coercive control, psychological drama, systemic failures in support services, hopelessness and isolation. So suicide is now the leading cause of death in domestic abuse cases, surpassing intimate partner homicides. Nearly half of survivors of psychological abuse report suicidal thoughts, and victims often die by suicide after long periods of abuse and inadequate responses from services. I've included a link on there for Every Life Matters. It's Cumbria Suicide Prevention and Bereavement Support Charity. They offer a number of free courses to everybody, and they're linked to their trainings on there. And Juliet Gray from Every Life Matters will be joining us for the 16 days of activism to do a session on the links between domestic abuse and suicide. Links between domestic abuse and substance misuse. So we've got domestic abuse and substance misuse often co-occur, but the relationship is complex and bidirectional. So substance misuse can exacerbate abusive behaviour in perpetrators. It is not the cause of the domestic abuse, but can exacerbate it. Substances can be used by victims to cope with trauma, and it creates barriers to accessing support. 93% of perpetrators with substance misuse issues reported using substances and then becoming violent. And 2/3 of women with substance misuse problems began using after experiencing domestic abuse. And substances are often used to numb emotional and physical pain. We've got some practice tips there about taking a trauma-informed approach and a non-judgmental approach. Ask about both the substance misuse and the domestic abuse sensitively, and work collaboratively across sectors and with that multi-agency. Don't assume that substance use causes abuse. Don't ignore the signs because the person is sober, and don't rely on stereotypes about victims or perpetrators. Do you want victims code, Mary Claire?
Yeah, thanks, Sally. So the victims code are baseline standards for all victims of all crime. So that's everything from a shopkeeper who has some sweets pinched, right the way up to people who experience domestic abuse and sexual violence. And these are things that we should be offering to all victims. Particularly for victims of domestic abuse, point 1 and point 4 are really important. Point 1 is to be able to understand and be understood. Children are defined as victims in their own right if they see, hear or are otherwise affected by domestic abuse. So that's all age victims of domestic abuse. We should be making sure that we are using relevant language that people understand, taking into account any neurodiversity. We should be using large font, braille, things like that that are accessible. We should also be using interpreters where people don't have English as a first language. We shouldn't be using people from the community, and we certainly shouldn't be using children to interpret for people. We have seen cases of this because it's quicker. Asking somebody if they are injured or if they've got a pain is completely different than trying to do a dash risk assessment with somebody when you're already asking some really, really intimate questions. So we need to make sure that everybody has got the opportunity to be able to be understood and understand. And point 4 is to be referred to services that support victims and have services and support tailored to your needs. We have a really good offer in Cumbria. There isn't a lot of money in the domestic abuse system. We've got some really dedicated professionals who will go over and above to support people. If we don't either work or make those referrals to specialist services, or at least offer them, we could be criticised further down the line. So just as an example, if we were looking to bring somebody's children to be cared for, and we hadn't either done that direct work or we hadn't referred to specialist services, if I was a defence solicitor, I would say that the application could be flawed. So we absolutely should have within practice standards a mechanism to make sure that we have considered referral to specialist services. It mentions there that babies, children and young people are defined as victims of abuse if they see, hear or are otherwise affected and are related to either the victim or the person that's caused harm. Victim support are our main commission service, and they will work with those who cause harm, victims and children over the age of 5, so they can provide that holistic family support. Next one, please. So learning and development. A couple of years ago, we did an analysis of domestic abuse learning in Cumbria, and it was seen to be a little bit bitty. So what we did was we commissioned Safe Lives to write us a package called Responding Well to Domestic Abuse, and that is the adopted baseline standard of training in Cumbria. Cumberland Council, along with Westmoreland and Furness Council, hold that training on licence, and that's for everybody within the partnership. It's bookable either. We do some internal Cumberland sessions for those of you that are Cumberland employees. We do some internal Westmoreland sessions, and we also do some partnership ones which we advertise on Eventbrite. They do get full really, really quickly, and that is a full day in-person training. We also offer some bite-sized sessions, which are the key themes of the full day, but just basically me and Ali talking really, really fast. So for your particular organisations, if you wanted to arrange a 90-minute brief and drop us a line, we are tending to do those more on a surgery basis, just to make sure that we get kind of out to as many people as we can. The police have DA Matters, which is very similar to our Responding Well. Our Responding Well was based on DA Matters, so the police have their own system of training. Next one, please. So before we wrap up, I'd just like to tell you a little bit about Annie. So Annie was a colleague who worked for the former Cumbria County Council, and Annie was murdered by his son. Unusually in Annie's Dardr, her family wanted a name to be said and a voice to be heard. There wasn't a pseudonym that was put in place for Annie. Annie died. Annie had plans for Christmas. Annie looked out the window and decided what coat she was going to wear. She did all the things that we do on a day-to-day basis. Annie isn't here to tell a story anymore. One of the recommendations of Annie's Dardr was that we needed to have an internal domestic abuse policy as a council. So we adopted an internal domestic abuse policy. It's been updated. We are encouraging partner agencies to either develop a domestic abuse policy if they don't have one. We're happy to share ours for people to kind of have a look at, adapt and amend. But something we are going to be doing in the next couple of months is going out to all partner agencies and asking for assurance that we do have those internal policies. Domestic abuse, like I said, can affect anyone. It affected Annie, it affected Tiffany, it affected Ruth, and it affected Chloe. So we do have people who are our colleagues who we are asking to support people who are living with domestic abuse themselves. Next one, please, Ali. So next steps are to access the professional curiosity and information share and learning. There's the link in the slides. Access the Responding Well training. That is mandatory for children's services, and for the police it's not mandatory for any other partner agency. We've just recorded how to complete a good dash training, which goes through question by question. That'll be available soon. Access the learning during the 16 days of activism, and I think Simone has shared the link for that in the chat. That starts next Tuesday, and we've got loads of bite-sized sessions. And sign up for our domestic abuse practice development forums, which we advertise via email to our strategic leads across the partnership, and that's for everybody in the domestic abuse field to come together and share good practice. So hand over to you, Ali.
We just continue with our next steps. So anyone who works in the field of domestic abuse has an interest, please do look at the Domestic Abuse Commissioner's website. We have some of the reports that she has done. I'm very proud to say that I was involved in the Learning from Loss report. I was one of the trusted readers and went to the launch event for it, and we have been part of a DAC office pilot which has fed into that. I was happily went off to London to for the launch of that one. A key report on that learning from DARDRs. She's got reports on victims in their own right and patchwork provision, and that was about how we meet the needs of domestic abuse survivors and victims across the country. There's also a link there for the Cumberland CSP for theirs, and I'll just check that we can get the Westmoreland one on there. I don't know whether it's on that slide or not. But the two CSPs have all the published DARDRs that we have on there. There is also a repository for nationally if anybody wants to have a look at the national DARDRs. I've put our contact details on there for Mary Claire or myself if you've got any queries. So yeah, Mary Claire covers Cumberland, I cover Westmoreland and Furness. So if you do have any queries relation to DARDRs or domestic abuse and any training development needs, please do contact us by email.